The first thing we're going to do is we're going to talk to our athletes or talk to our clients and find out, what are you looking to do? Are you looking to improve your performance? Are you looking to minimize injury risk? Are you looking to kind of get over the hump and find out where have you been and where do you want to go? We also want to see how the athlete goes about preparation and goes about their getting ready to do their craft. And so we want to see how they warm up, what kind of things they do to get ready to participate, what kind of things they do to prep themselves for performance. And we look right there to find out if there's anything we can add or subtract from their general routine to improve their overall performance and overall ability. And then once they're feeling ready to go, we'll go ahead and set up our camera system and make sure that we're ready to capture their movement. I think we're conditioned now in the world of the iPhone, in the world of social media, that we can always just take a video and get a good look at something that we're doing in our daily activities. But what you can do with your iPhone doesn't compare to what we can do with 8 state-of-the-art motion capture cameras. We can do 2-dimensional or 3-dimensional motion analysis, and that works at a firing rate of 240 frames per second. We're going to have the most state-of-the-art motion capture system in Wisconsin. And pretty much in the Midwest. So we offer our athletes a chance to really take a look at what they're doing well and what they're doing wrong and what we can do to kind of improve their overall function. If a professional athlete or a very elite athlete has multiple coaches and athletic trainers and people around them to help them succeed, maybe your local high school athlete here doesn't. And so we can give them an extra step or an extra edge in their game by being able to look at their motion through the eyes of a healthcare professional, but also with the frames of the camera, and see how well we can break their movement down and find little things that we can do to make them feel better and operate at a higher level. We really look at the athlete from the bottom up and the top down. We get a chance to look at many of the movement faults that are common in overhead athletes. We look at the mechanics of their thoracic spine and lumbar spine and whether they're moving too much or too little. And then finally looking at the upper extremity and seeing if the shoulder and elbow are being stretched too much or being worked too hard. We look to see if they're achieving external rotation or a higher level of shoulder mobility, and then we also look to see if they stay under control as they finish their follow-through. The bread and butter of what most physical therapists and athletic trainers know is their clinical examination or their training room examination. So we're used to looking at an athlete's shoulder or a hip or back and seeing if they have enough range of motion or strength to complete a particular task. The throwing analysis allows us to see those body segments move in real time, but at a rate that we can understand with our own eyes. So when we look at an athlete through the motion analysis, we may see a lack of motion in one area or a weakness in another area. And then if we get them on the table and get a chance to compare our clinical examination to the throwing analysis, we can find out if things add up or if there's something they're missing that we need to work on with an exercise program, manual therapy, or any of the other treatment modalities we have here at Bellin. All the research points out that overuse is one of the biggest problems for young throwers. And so if many kids, if they have bad mechanics or they're training too much, throwing too much, they become at a significantly higher risk for injury. And so if these young kids are out there competing and training hard, we want to make sure they're doing it with the best mechanics possible. So we would love to be able to see your youth athletes and your high school athletes in here. And the beautiful thing with the experience and the training we have here with the high technology level that we're working with, we can evaluate your young athlete and watch him or her grow and see how they change as the years go by and see how their mechanics improve with the technology we have. Every athlete that comes to Bellin can rest assured that they'll leave with information about their throwing analysis or their movement analysis that they had that day, a video or DVD that they can go home and re-watch, as well as an exercise program that they can work on in the days to come before they come back for a reassessment or a checkup. Some of the folks that come to see us, or some of the young kids that come to see us, they don't have any issues, they have no pain, they're interested strictly in performance enhancement, and we of course offer a package of visits to come in and at a reduced rate to come in and get your assessment and then also come in and get a follow-up or two to make sure that the things we've worked on in our assessment and our breakdown of your movement can definitely translate into improved performance.